Hey, my name is Tyler Weitzman, and I'm going to cover here some of the basics about sleep. Some people may have heard that the average sleep cycle is 90 minutes long. That is accurate. But within each cycle, there's actually different stages of sleep. Before I describe the different stages of sleep, there's some terminology that is important to explain. First type of terminology is what's called REM, which stands for rapid eye movement. This is a type of sleep in which your eyes are rapidly moving from side to side. Now, this is the kind of sleep where you're actually in a dream state. REM is a pretty unique stage in which your brain is awake, but your body and your muscles are paralyzed. So that way you don't actually act out your dreams. Now, of course, your brain is still controlling your breath. It's still controlling your heart. You just can't voluntarily move your muscles while you're acting out in your dream. NREM sleep, it's non-rapid eye movement. You're asleep, but you're not dreaming. Your brain is not awake. And the last thing that's important to understand is waves. A lot of sleep studies use an instrument called an EEG in order to be able to actually conduct an experiment where they can actually view the exact waves that are coming out of your brain. This is an example of what it might look like, and usually talk about the frequency of a wave as being how many times per second the wave is oscillating, whereas the amplitude is more about whether a wave is loud or quiet if you're talking about sound. These are the different kind of waves that are measured using EEG instruments. If you were to sort these by order of the frequency again being what the oscillation, how many times per second the wave is happening, it would look like this. And in fact, the higher the frequency of the wave is, the more awake you are. Each one of these waves correspond to a different state of wakefulness or sleep, where a gamma wave is large-scale brain network activity like memory, attention span, things that you're really thinking. Beta wave is your normal wakefulness, and then the bottom three waves are related to sleep. Alpha waves is the sort of in-between state. It's if you're meditating, you're probably in an alpha wave state. It's relaxed wakefulness. Theta waves are sleep, and delta waves are the lowest frequency, and they constitute deep sleep. Now, the amplitudes are also different for these waves. Delta waves, for example, for deep sleep are usually a higher amplitude, and so are theta waves. So the frequency becomes lower, but the amplitude becomes higher. Now that we understand these waves, we can look at the different stages of sleep and understand them in terms of the different waveforms. In the first three stages of the sleep cycle, there's non-rapid eye movement, meaning you're not dreaming. The first stage is a transition from wakefulness, from alpha to the theta waves. The second stage is actually the bulk of the sleep. You spend about 50% of your sleep time in stage 2. One final piece of the sleep structure that's very important is actually the start time and the end time of the entire length of these cycles. In your brain, there's a specific part of your brain known as the, I don't know how to pronounce it, that actually regulates your circadian rhythm. And so you have a biological clock in your body, and that biological clock produces this rhythm and regulates the timing. And this circadian rhythm actually responds very strongly. The biggest factor that it responds to besides genetics is actually light. So if you have light exposure at nighttime, that will actually make it more difficult for you to fall asleep because your body tells the difference for when it's supposed to be awake and asleep based on a big misconception about sleep is the relationship between the hours you spend asleep and alertness. People think that if they're going to spend 12 hours sleeping, they'll be very alert because they'll have this full night of sleep. But in fact, your alertness is defined more by your circadian rhythm, more strongly by your circadian rhythm than by the amount of hours that you've slept. Now, it is true that there is what's called sleep debt, which is the cumulative effect of not getting enough sleep. The more that you forgo sleeping, the more you're going to have to make up for it later. And it is true that sleep debt comes with other health risks and problems if you accumulate too much of it, and that can definitely hinder your alertness and your energy. However, sleep inertia is actually a much bigger factor when it comes to understanding why is it that you wake up groggy. And sleep inertia happens when you transition from being asleep to waking up, and inertia is describing the momentum of the sleep carrying through and you still being a little bit asleep. That usually depends on your circadian rhythm and whether the sleep that you got that night and whether the time that you woke up is actually aligned with your circadian rhythm. So there's been experiments and studies from NASA studying how pilots their schedules and their performance. And the discovery was that, in fact, circadian misalignment leads to performance impairment. Your body also has what's called the circadian low, the time of the day that it's used to being in that stage of deep sleep. And usually your circadian rhythm dictates different, what's called a window of your circadian low, and also a window of alertness in the morning. So your body gets used to the certain rhythm of being sleepy during the middle of the night. For an average person, this would be between 2 and 6 in the morning. And depending on the person, there's different phase angles for their circadian rhythm. Some people might have a chronotype of being the type of person who generally has their circadian low more in the morning, and they'll be more groggy in the morning. And other people will be, as opposed to night owls, they'll be more morning type people. So for people who are suffering from sleep delays and morning grogginess, the best thing to do is actually just to have as consistent as possible of a sleep schedule, and to wake up at the same time every day and then go to sleep at the same time every day, as opposed to changing and randomly going to sleep later one day and waking up early the next day. Because if your body can get into the same rhythm consistently, then your wake up time will become aligned with your circadian rhythm, and then your performance will not be impaired in the morning. Now, different people also suffer from different sleep disorders. There's a few common sleep disorders and some more rare ones. Here's a list of a few sleep disorders, and to go over a few of them briefly, I'll talk about sleep apnea to start. Sleep apnea happens as an obstruction to your breath while you're sleeping, when your body's not able to always get breath consistently and get the same supply of oxygen as it can consistently. And that can have many different factors and reasons why it happens. One type of sleep apnea is called obstructive sleep apnea, and that's related to your muscles specifically. Even though your brain is controlling your breath, your muscles do get paralyzed while you're asleep. And so if your throat muscles relax too much, because usually your muscles in your body relax, if your throat muscles relax too much, your throat becomes narrower and there's less space for the airway to come through. And so generally your brain is supposed to keep your throat muscles still constricted and working as you are when you are awake, but in certain cases they relax too far, and that causes obstructive sleep apnea. Likewise, your tongue, if it's relaxed and if it's bigger and if it's too far back, it can also block the airway. And there's different surgeries that can be done to fix some of these things. For example, there's an advancement surgery for pulling the tongue forward, and that can reduce obstructive sleep apnea. The other reason for sleep apnea could be what's called central sleep apnea, and that's when your brain signaling is actually having problems controlling the breathing, not necessarily the muscles, but both of them. And of course, both of these factors could also be a reason in a more severe case of sleep apnea. Now, the other disorders here, restless leg syndrome, has to do with the muscles in your legs while you're asleep, and narcolepsy is people who are having trouble staying awake during the day, and for any large period of time, they cannot maintain their wakefulness. Insomnia is the inability to fall asleep at night, and exploding head syndrome is a rather rare occurrence, but still a sleep disorder where you wake up thinking that you heard a really loud noise, but in fact there was no noise at all, and it's totally still unexplained and usually doesn't have any serious consequences. Now, the final thing I'd like to touch on in terms of performance, which is the part about sleep that I find most fascinating, is it turns out that when you're asleep, that is the time that your brain is most able to consolidate the memory. There's been many experiments that show, both in terms of motor skills, so muscle memory, and as well as just learning factual information, that when you go to sleep and after you wake up, the consolidation of the memory occurred while you were asleep, and any test that you perform right after that first night of sleep, you will perform significantly better than the same day that you learned it. Now, that's not to be confused with what's known as retrograde amnesia, where we often have difficulty to retrieve information that we thought of in the past or experienced in the past. If you were just falling asleep when you came up with a great idea, it's unlikely that you'll remember it when you wake up in the morning. To summarize, today we covered the different stages of sleep, how these stages form cycles that repeat themselves, and how your circadian rhythm regulates the time that your going to bed and waking up, and also has a big effect on whether you're going to be groggy in the morning, depending on whether it's aligned. Finally, we also covered some sleep disordered, and we covered the idea of sleep debt, where you can actually accumulate a debt of sleep if you don't get enough hours of sleep. So be careful driving if you're drowsy, because drowsiness is red alert.